afternoon, everyone. Thank you for joining us for this local COVID-19 update. Before we begin, of course, I want to remind everyone that and acknowledge the fact that our country passed a very grim milestone when we passed 200,000 deaths, the mark this past week. The pandemic in the United States continues. And yesterday, the head of the CDC told Congress that 90% of the U.S. population is still susceptible to contracted COVID-19. That should be a heavy reminder to all of us that we need to stay vigilant and keep doing everything we can to limit the spread and the opportunity of this virus in our community. For our continuing local response to the pandemic, I wanted to share a few updates. First, the City and County of Denver has updated our public health order to bring us in alignment with the state's new DOW system. Denver is currently in the safer at home level 2 phase, but like several parts of Colorado right now, we're seeing our case numbers rise again, regrettably rise again, which we will address here in just a moment. Second, as you are aware, we will be closing the testing operations at the Pepsi Center site at the end of the month. This mass testing location has been extremely beneficial to our community and a critical tool in our public health response over the last several months. This has been an unbelievable effort by so many people to make this happen. And I just want to pause long enough to say thank you to them because of their efforts, tens of thousands of people have been able to get tested. First, I want to thank the Denver Department of Public Health and Environment. You're going to hear from Bob McDonald, the leader of the department, in just a moment. I want to thank the Public Safety Department, certainly Murphy Robinson and Matt LaBerge, who runs the crime lab. I want to thank Armando Saudate and Emily Locke of the Safety Department. And I want to thank, of course, our Department of Tech Services for their tremendous leadership. Dave Edinger, who is the Executive Director. And again, we cannot say enough about the Kroenke Sports Enterprise people over at the Pepsi Center. We want to thank them for their tremendous leadership and vision in leaning in and be really helping to enable this process to go forward. With additional large capacity sites like this one now open around the metro area, we're in a place now that we can refocus our city testing efforts toward more community-based testing. In addition to the work that has already occurred and will continue, including pop-up testing events and our mobile testing, we will be setting up community testing hubs where residents, especially those in under-resourced communities, can get tested. The first of these community hubs sites will be at the Paco Sanchez Park and will open somewhere around the beginning of October, and additional locations will be coming online in the coming weeks. So we're really excited about really the dispersing of these sites around the city of Denver. In the meantime, as we have previously announced, the Pepsi Center testing site will have a dedicated lane for college students studying here in Denver. We really want to encourage our young people to use this testing site. We're doing this because we are seeing a very focused increase in case rates among college age population, particularly on our university campuses. This is what is driving the increase in case numbers here in Denver that we are seeing. Due to these increases this morning, the Denver Public Health and Environment Department issued additional public health orders to increase protective measures on our college campuses and hopefully stem the increases in cases on the campuses. These orders include requiring additional health screenings for students, staff, and visitors, as well as notification of confirmed positive cases to DDPHE within 24 hours. Enforcing strict adherence to the city's face covering order, restricting access to on-campus housing to students and essential personnel in those buildings only, additional measures for fraternity and sorority activities, and recommending that schools voluntarily suspend all non-essential in-person extracurricular social activities. If we keep seeing these case numbers increase on our college campuses, we will issue additional orders requiring, not just recommending, additional restrictions for on-campus activities. I know the gatherings that usually happen at the beginning of a new school year and other campus activities are an important part of college life. And I can tell you, I, for one, truly enjoyed them when I was a student and on campus. But we got to recognize that this is different. This year is different, and students have to take these public health measures seriously. Being young doesn't come with immunity to the virus or very serious health issues that can result from it. And so we are really encouraging, deploring our young people to not gather in large groups. Of course, maintain social distancing. Again, wear your mask. And if we do these things, as well as washing our hands and carrying sanitizer and using it very frequently, this is how we're going to get this virus back under control. The alternative and long-term implications are certainly not at all anything that we want to have to go to, and certainly will change how we look at this school year. But if our young people do what they have to do, they can do what they want to do down the road. So we have to stay focused. I also know that you're probably going to ask, if you're doing this with our colleges and universities, does that mean you'll be taking similar steps with Denver Public Schools? And the answer to that is simply, like our campuses, we will closely monitor the situation with DPS as they begin to welcome students back to the classroom in some capacity beginning in early part of October. And we will assess any steps that need to be taken to protect those students, the teachers, faculty, and of course the people who might also become vulnerable as a result of their contact with these individuals. With that, let me turn it over to the Executive Director of the Public Health and Environment, Bob McDonald, for more of what's going on with these orders. Bob?
Thank you, Mayor, and I want to thank everyone who's able to join us this afternoon. I'm going to go ahead and start my updates with a slide that I know everybody has seen before, and it's this slide right here, the epi curve for this virus. And we've talked about the things that have contributed to this first spike that we saw, and those things that we did that brought that curve down, and then some of the things that brought it up again during the summer months with increased visitation from and recreational activities during the summer, and visitors from out of state, and just less physical distancing, and 4th of July. So we saw that spike, and then we implemented controls to bring that spike down, restrictions on alcohol sales, and we enhanced our compliance program here. And now here's where we are. We're starting to see this increase again, and we've identified this increase largely the result of, again, less physical distancing and activities that take place on and off campus settings. And so this is what we need to watch here, and it's the reason for these additional public health orders that we implemented today. Which include the things that I'll go through next. I want to start out by saying every step of the way, when we implement public health orders, we work very closely with those partners that our orders impact. And so we've been in close contact with our post-secondary partners to get feedback on these requirements so that they're part of the process. And I want to stress that these requirements are not being implemented because our post-secondary partners aren't doing everything that they can to stem the tide of our cases. I think they've been every step of the way doing what they can, working closely with us, doing a lot of great things. These orders will set a little bit more structure for their continued efforts. And those requirements will include mandated health screenings to make sure that, to the extent that we can, that we don't have campus visitors and students going into the various buildings on campus and venues where they might be experiencing symptoms with COVID-19. We're going to expand our face covering requirement to include athletes that are in more of a team setting outdoors, where teams can socially distance during practice and during games. They won't have to wear face coverings, so the tennis players may not have to do that, where other sports, football and otherwise, they'll have to wear face coverings. We've seen outbreaks on teams, being spread from team member to team member. So we want to try to get that under control. We don't want to get to that space where we have to suspend all athletic programming. So we're hopeful that this increased measure to wear face coverings during those close contact sports will help get that in check. And then we're also going to require that when they're traveling to and from various games. We've gotten some information that sometimes sports teams will travel together, either in cars together or in other types of vehicles where they're congregating closely with each other. They're going to have to wear face coverings during transportation to and from sporting events. And then that'll be a requirement for teams that are visiting Denver as well. We want to make sure that we're protecting our own athletes here in Denver from what other team members could bring in. And then there'll be required reporting to the department anytime there's a case. Universities will have to report that within 24 hours of them being notified. That's really important because we want to jump on that contact tracing effort as soon as possible. I think, again, largely, I think universities have been doing very well with that, but we want to reinforce the importance of that through this public health order. And then anytime there's one or more case on a team, we'll have to suspend the activities of that team until we can work through that and make sure it doesn't spread from team member to team member, because we are seeing that right now, and that will include practice and games. There'll be some additional requirements regarding the commingling of students in between dorm building settings. We want to make sure that only students that live in a dorm building are going into that dorm building. That'll cut down hopefully on the interactions that might contribute to transmission in housing settings. And then we're asking all universities to develop a compliance plan such that they can monitor all of these public health requirements and take action when necessary. Every step of the way, our department is focused on compliance. This is a virus that, with even just a little bit of non-compliance will go a long way. I think largely throughout our community, people are complying, businesses, universities, and many individuals throughout our community are complying, but just a little bit of non-compliance, and we can see a spike of cases that will impact everybody, impact all of us, all businesses. And we will take enforcement action when necessary against students and against universities. I don't anticipate that, but again, we'll do what we need to do to make sure that we keep these case numbers in check and keep everyone safe from this virus. The mayor had mentioned that the Pepsi Center will be standing down at the end of the month, and we've mentioned this a number of times throughout the past month and a half, that the Pepsi Center stood in the gap. We had to get in front of this virus. We had to find out what was happening in our communities. We needed to get some large-scale testing going, and that was done. And now it's time to stand that down and be more targeted with our testing efforts. And so you can see here, these black markings here indicate all of the areas where we have stood up community-based testing. You can see the Pepsi Center is here, the blue star, and one can imagine how difficult it might be for some of our underserved communities to make it to the Pepsi Center. And so we are much more targeted now with our testing efforts, working very closely with our partners at Denver Health and Hospital Authority. I want to thank them as well for partnering with us on this effort. And then the red markings here are those that will be opening up very soon, a couple of them by October 1st when the Pepsi Center stands down. So we feel very good about where we are with that effort. And with that, I will turn it back over to the mayor.
Thank you, Bob. And again, I want to just share with everyone how seriously we take this recent rise in our cases here in Denver. And but again, as Bob iterated, we can get these under control if we follow the orders as laid out by Bob and his department. So Teresa, we can go to question and answer with the members on the line.
Sure, Mayor.
Hi, Teresa. This is Esteban with Denverite. Mayor, can you just talk a little bit about, so these public health orders for colleges and universities, when did they take effect? And why is it that this population is driving the spike in cases in this city?
Bob, you want to take the first part of Esteban's question?
Yeah, sure. It takes effect immediately. It's in place now. Now, having said that, we recognize that, our partners at the leaders in our post-secondary institutions, they need some time to put additional things in place, and we're going to work closely with them, but it is effective immediately.
And Esteban, just to answer your question, we've seen across the country, of course, young people, and as we're talking now, the college age students, understanding the challenge, but not adhering or at least taking it seriously a threat to themselves, the spread of COVID. And so for whatever reason, young people still have this sense of immortality and sense that they cannot be impacted by this virus, when in essence, not only can they be impacted, but they stand to, be a real severe threat to a lot of people who are around them. And so we just have to continue to ring the bell and do everything we can through the various means in which they pay attention, social media and so on and so forth, to encourage them to adhere to these orders and to practice good protocols.
Jason
Next
Gonzalez with
question.
Chapter.
Hang on,
Jason
Esteban,
Gonzalez.
let's give somebody else a chance to ask a question.
Jason?
Yes. So, how does is going on at CU informing what you're doing here in Denver?
Well, obviously, Bob, I want you to chime in here, but what you're seeing at CU and other major universities on a smaller scale, you're seeing it on campuses like DU and Regis and to some extent at the Metropolitan State University, even though it's harder or I should say on a Auraria campus. But yeah, CU serves as a kind of a macro example of what could happen when young people are not following the protocols. Bob?
Yeah, thank you for the question. The director of Boulder County Health, Jeff Zayak, and I have been in touch multiple times throughout the last week or so, sharing ideas, sharing information. And, I think he took the right steps he did what he felt he had to do up there. Given the cases that they have, we're hoping we don't have to get there, that we have to go quite as far as that. But given what they're seeing up there, I think it's been a very thoughtful plan that they put in place, and we continue to keep in touch.
And one more question: how worried are you about that spread among college campus communities, then leaking out into the greater Denver population?
Yeah, that's a great question, and that's a real possibility. I think it's important for young adults to understand that while you might be able to handle this virus a little bit better than our most vulnerable people, you can still transmit it. Whether you're experiencing symptoms or not, it can still be transmitted. So, I just had a couple of pictures sent to me last night from our compliance teams where we've seen students congregating in large numbers in park settings and around campuses, and that has to stop to get this under control. So please, again, a little bit of non-compliance goes a long way. So please don't congregate like that. And if you have any questions about the orders that we're rolling out, please reach out to us.
And Mayor, I just want to jump in quickly. If you could reiterate about that dedicated lane at Pepsi Center, which I know we did send Bob's office had sent something out, but I think it's important because I know you'd been asking for that for a bit, and talk about the importance of that.
Well, I think it's extremely important, and certainly Bob can talk about why we ultimately move forward with it. I made the request that we either shut down the Pep Center, make it completely available or dedicated to students, or we create a special lane for them to come through and get tested. We have thousands of young people who have started school in the last month, and we want them to not only follow protocols, but get tested regularly. And with the Pepsi Center still stood up until the end of this month, we felt it imperative that we created an opportunity for them to get through the testing process very quickly. And so this dedicated lane is meant to help them do that and hopefully allow us to get ahead of asymptomatic students who may be carrying the virus and hopefully, again, blunt the spread as we have always attempted to do.
Amy Lewis here, Fox 31. I have a question about the driver that pushed through the protesters last night. A question for Mayor Hancock. What would you recommend for drivers?
First, I'm sorry, real quick, can we get to the COVID related questions first? That's what the purpose of this is for. So if we can come back to that. If anyone has any other questions regarding the health order that was issued today, can we finish with those questions?
Yeah, hi, this is Bill Judas at Bloomberg News. With regard to COVID and Boulder, have you done any contact tracing to indicate if there's been a pickup in spread from CU or the city of Boulder or Boulder County into Denver colleges, or just the general population? Thank you.
Well, the short answer is yes. I mean, we work very closely, not just with Boulder, but with all surrounding public health departments as part of the contact tracing efforts. We're not seeing that right now. When we investigate outbreaks, we immediately issue quarantines and that's very nuanced when we issue quarantines and when it's not necessary. But if we do, we need students to stay quarantined where we ask them to quarantine, where we ask them to isolate. They need to adhere to that. If they go to their friend's house to ride it out, or their parents' house, or what have you, it's only going to spread. So they need to quarantine where we ask them to quarantine, and students and everyone needs to answer that phone if we're reaching out, trying to contact you to give you instructions on how to quarantine as a part of that contact tracing effort. So please, if we leave you a message, if we leave you an email, please reach back to us. It's very important to do that.
Hi, this is Ed Seelover with the Denver Business Journal. I'm curious about the mask rule for athletics that you mentioned, particularly football, requiring students to wear them in college while playing. Is that rule going to be enforced as well for any high school teams that resume their season and for the city's professional football team? And if not, why not?
Mayor, do you want me to take that question?
Oh, yeah, please.
Yeah, okay. Thank you for the question. Very good question. You know, every step of the way, we've targeted our public health orders to where we are seeing cases stemming. And we are not seeing that at a professional sports level. We are not seeing it at the high school level. The state health department works very closely on the professional sports activities. They are taking the lead on that. And so I don't know that I can speak to that now. I'm sure they'll be very thoughtful about whether or not they need to implement that for professional sports. At the high school level, again, that's a possibility. We know that every one of these orders that we implement comes with some complications. It's hard to wear face coverings, and it's inconvenient to wear face coverings when playing sports. We understand that. We are doing that hopefully to avoid having to suspend all sports programming altogether. That would be the next step. And so we'll take it step by step with the sporting events outside of where we are right now.
Any other COVID questions? Hannah, Conrad?
Yeah, I wanted to ask, can you just explain the reasoning behind closing the Pepsi Center? I mean, we just said we're seeing spikes in cases among young people. And it could potentially spread to other more vulnerable populations. So why is the city closing this massive testing site right now?
Well, it's strategic. We've been saying for months now that the Pepsi Center was stood up quickly so that we could get information to successfully manage the pandemic and the virus spread in Denver. But we've always said that it's not getting to our most vulnerable populations. And so it makes sense to stand that down now and more strategically set up these sites to take the place of the Pepsi Center. We're going to monitor our testing numbers very closely. I'm confident that we are not going to fall below the recommended level that CDC puts forward for a population our size. And we'll adjust accordingly if we need to. But it's all about being strategic with the resources that we have. And keeping our most vulnerable populations in mind every step of the way.
And Bob, what's the city's positivity rate right now?
I believe there's a slight uptick. I have not looked at that this morning. Still under 5%, well under 5%. A couple of weeks ago it was at 2.5%. It's gone up a little bit. And I want to go back to what I said a little earlier about a little bit of noncompliance goes a long way. Back on September 9th, our 2-week cumulative incident rate average was 78.4 cases. Today, 3 weeks later, 160 cases. And so it's very, very important for everybody. Again, I can't overstate this. Our college students, younger adults, please wear those face coverings. More and more science points to how effective they can be.
Hey, Bob, this is Conrad. I got one quick question. Can you give us a little bit of more insight onto, I guess, enforcement? I mean, does this mean tickets or citations or fines for college kids or anybody who's not following the rules? And have you found those methods to be effective elsewhere in Denver?
Well, I heard 2 questions there. My answer to the first question is I hope not. I hope we don't have to issue a summons to universities and to college students. Again, I think our leaders, our post-secondary leaders have been very thoughtful and collaborative, and I think they're going to do everything that they can to make sure that their students are complying. If enforcement's necessary to get compliance, then that's what we'll do. But I hope that we don't have to get there. And I'm sorry, could you repeat the second part of that question for me?
Yeah, basically, I was looking at a list of businesses the other day. Some of them, like maybe 157, had been cited in some way since like July. A lot of them were repeat offenders. I was curious if those summonses, those citations, fines, whatever is being handed out, has been by and large effective throughout Denver.
Well, I absolutely believe it has. We've been one of the most proactive departments in the state in terms of making sure that people are complying with our public health orders. It's not just about compliance. I mean, that's what's the major driver in that, but it's also informative. I don't want to consider additional public health orders without having an understanding of whether or not people are complying with those that we've already implemented. So it's very informative to get that information about our level of compliance, but I believe it has helped. When you look at the epi curves for surrounding counties, there's so many more people, and yet we don't have double the cases that we might have double the population, and we might be much more dense than surrounding counties, but we don't have double the cases. And I think that's largely contributed to our compliance efforts.
Let me go back to the question with regards to the Pepsi Center and why we are bringing it down. I think Bob was right on target. Obviously, we want to meet our residents where they are, and we still have a disproportionate impact on low-income communities, communities of color, with regards to the virus and lack of access in terms of testing, as well as adequate medical support. But we also have a limited amount of resources in terms of dollars, and the city of Denver is still waiting for some of its FEMA reimbursement, and we have been, quite frankly, carrying this Pepsi Center with our dollars. Our dispersed strategy gets us from just managing a regional, I shouldn't say just, but managing a regional effort to our more local neighborhoods where we can, again, meet our residents where they are, and it's much more, I think, financially manageable until we know where we stand with regards to the reimbursement around FEMA.
Any more COVID questions for the mayor or
Yeah,
Bob?
Yeah, can you just clarify how many colleges and universities will be impacted directly by these public health orders?
Well, the public health orders apply to all campuses, all universities, all students. I think many of the orders that we just rolled out, university leaders already have those things underway. But it's effective now, and it applies to everyone in a post-secondary setting.
This is Vinny at Bloomberg. Speaking of age groups, do you see many people that are not in college that are 18 to 20 to 25, having the same type of problems, the same time of breakout? Is that a problem?
Well, sure. There are, we're always going to have cases in all age groups. And certainly there are cases in college age groups that are not stemming from college settings. But when we look at the data and based on the outbreaks that we're seeing, they're primarily associated with campus settings and universities.
Vinny, thank you for that. And I want to circle back now before we wrap up to the Fox 31 reporter, and I didn't get your name, but go ahead with your question.
Thank you. Yeah, sorry about that. Yeah, this is about the driver that pushed through the protesters last night. Wondering if Mayor Hancock could give any sort of recommendations for drivers that, may encounter protesters while, driving the street.
Well, I know that the situation last night is still under review by the Denver Police Department. I think they're on here with us last night. We got to not assume that every driver is listening to the radio or is aware that a certain protest is occurring down the road in front of them. And it seems like last night this driver, came into a protest. His car was surrounded. This is based on the report that I received from the police department today. They did stop the driver a few blocks away. Apparently the driver panicked and felt threatened and panicked and left, try to get out of the scene. It did not look good on video, and I certainly understand that, but we got to allow for all the details to be made public before we pass judgment. But the difficulty is for everyone, of course, to be informed that there's a protest up ahead. I don't know what you recommend to people, but if you get any sense that there's something going up in front of you, try to divert and get away or move on from that situation before you find yourself into the thick of the protest. But I think the admonishment goes both ways, is that we have to make allowances for drivers who may not be aware that something may be up ahead and find themselves in the middle of a protest. And I think the protesters have to also be willing to create a safe passage or for someone to get out of there in a safe manner. So it's a tough situation. Yesterday was a tough situation. As from what I can understand it, I'm thankful no one was hurt. We haven't had any, at least no one was seriously hurt, I should say, and we haven't had that report come into DPD at this point in time.
All righty.
Thank you.
Thank you, everybody. Thanks for being here.
Thank you.